You there, tell me, what are the levels of evidence in medical research? I think you've seen some video also. Yes, sir. I've seen a YouTube video and it quotes the Oxford Center for Evidence Based Medicine. Level 5 is the lowest quality evidence, and level 1 is the best quality evidence. Level 5 is expert opinion, level 4 is case series, level 3 is case control study, level 2 is cohort study, level 1 is randomized control study. Whoa, whoa, whoa. What about systematic review? Where is that? Sir, depending upon which kind of study we are systematically reviewing, it may belong to level 1, level 2, or level 3. What does that mean? Sir, if we review randomized control studies systematically, it belongs to level 1A. If we are doing systematic review of cohort studies, then level 2A. And if we are doing systematic review of case control studies, that is level 3A. So there are subdivisions of these levels also. You mean to say there is 1A, there will be 1B also, 2A, then 2B also, 3A and 3B also. Not only that, sir. 1A, 1B and 1C is there, 2A, 2B, 2C is there, 3 only has A and B. You're acting very smart. Tell me all the levels. So, sir, level 1A is systematic review of well-designed, well-conducted randomized controlled trials. Level 1B is evidence from an individual, well-designed, well-conducted randomized controlled trial. Level 1C is an all or none cohort study. Level 2A is systematic review of a well-designed, well-conducted cohort study. Level 2B is evidence from an individual cohort study. Level 2C is ecological study. Level 3A is systematic review of well-designed, well-conducted case control studies. And level 3B is evidence from an individual case control study. Level 4 is case series or poor quality cohort study or poor quality case control study. And level 5 is expert opinion or bench research or opinion based on physiological principles or first principles. Wait. You mentioned that poor quality cohort study is level 4. Then where is poor quality randomized control study? So that's a very good question. So a poor quality randomized control trial is equivalent to a very good quality cohort study. So that would be level 2B. So what is all or none cohort study? So sir, if there's a study where the efficacy of a drug is being tested and some participants are receiving the drug and some participants are receiving a placebo. The ones who are receiving the drug are showing complete recovery, not graded response, not 80% recovery, 100% recovery. And the ones who are receiving placebo, that is not receiving the drug, are not showing any signs of recovery. That is an all or none cohort study, which is a very good study, but still it is a cohort study. So it is 1C in the hierarchy of evidence. And you said something about ecological study. What is that? So ecological study, also known as outcomes research, is when the outcomes of a therapy or a vaccine or any kind of study topic is tested on a wide population, not just on a group of individuals. That is ecological study or outcomes research. So, sir, can I ask you a question? Yes, tell me. What kind of answer do you expect from me? So, well, if it's a Viva, then I expect you to mention it very quickly in a very confident manner. You should start it like you did, that level 5 is the lowest quality evidence and level 1 is the best quality evidence. Level 5 is expert opinion, level 4 is case series, level 3 is case control study, level 2 is cohort study, and level 1 is randomized controlled trials. That's a good way to answer a Viva question. And if the examiner asks you further questions regarding subdivisions and where does systematic review figure, then you answer it accordingly. Invite those questions, wait for those questions. Because often examiners don't want to get into too much detail about this topic, which is not a core ENT topic after all. However, if the examiner has a keen interest in this, or this question is asked in your theory exam, then it's a good idea to mention the source as well as the subdivisions of each level. In that case, you should approach it by saying, I am quoting Oxford Center of Evidence-Based Medicine, and the stratification of the levels of evidence is 1A, 1B, 1C, 2A, 2B, 2C, 3A, 3B, 4, and 5, and then mention what all are there in each individual levels with each example. Because as you have mentioned, all these levels have more than one example for each level, almost always. Then the examiner can ask you follow-up questions regarding what is evidence-based medicine, in which case you should say that in modern practice, if we are trying to find out the treatment of a particular disease, we search the database for the best quality evidence. We find the best quality evidence, which is level 1A, and then we use the clinical experience of the doctor concerned. In this case, it might be me, and we also take into account the values of the patient. So, best evidence regarding treatment guidelines, clinical experience of the doctor prescribing the medicine, and the values of the patient about to receive the treatment taken together results in the decision making of what kind of treatment to prescribe to the patient. That is evidence based medicine. Very well said. The examiner can also ask you what is meant by first principles. So, first principles are basically guiding fundamentals, which are basically the culmination of all the scientific knowledge that we have about a given domain. For example, if we take the example of UFO or unidentified flying objects, all of us know that the universe is extremely vast, and it is plausible to believe that in some corner of this universe there is intelligent life that has figured out intergalactic space travel and is now visiting Earth to investigate. That is first principle thinking. In the real world, we can think of Elon Musk, who went about trying to buy space shuttles from Russia and found out that they were prohibitively expensive. So he found out the individual cost of the raw materials required to make a space shuttle, and he found out that they were much cheaper. Of course, procuring space shuttle raw material is not very easy. So that's first principle thinking. Somebody might also ask you what is meant by bench research. Bench research is any research that is conducted in a laboratory. It may be computer simulations of how molecules interact with each other, or studies performed on animals like transgenic mice, or studies done with chemicals. So laboratory research is bench principles. I hope this time it'll be easy for you to remember.